Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Mwaka. First, the highlights. Medical Director of Specialist Hospital in Yola, Adamawa State, describes his new molecular lab as one to serve beyond the state's borders. And later in the program, a discussion with the chairman of the Commissioners for Health Forum on her new method of tackling COVID-19. And Finland pauses use of Moderna COVID-19 vaccine for younger males due to rare cardiovascular side effects. The Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says that almost exactly 1 year ago today, the world was expecting vaccines for COVID-19. The WHO DG reminds the world of the need for effective use and equitable distribution of the COVID-19 vaccines, saying that we stand on the precipice of failure. According to him, Africa has vaccinated less than 5% fully vaccinated, with 75% vaccination in high and middle-income countries. Today, with the United Nations Secretary General Antonio Guterres, both leaders called for global COVID-19 vaccination strategy to achieve global COVID-19 inoculation by 2022. The WHO also announced a standardized definition for long COVID, that is, post-COVID-19 condition, which occurs in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually 3 months from the onset of COVID-19, with symptoms that last for at least 2 months, and saying that it cannot be explained by an alternative diagnosis. Meanwhile, 297 new confirmed cases and 9 deaths were recorded in Nigeria, putting the total cases at over 200,000. Here's a look at the virus update.
297 more persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the FCT again recorded the highest number of infections with 104 cases, followed by Lagos, which had 40 cases. 28 cases were recorded in Gombe. Rivers had 27, Plateau 21, Edo and Kano had 14 cases each, Kaduna had 13 cases, Benue 12 cases, and Osun had 10 cases. Other states include Ondo, Imo, Delta, and Ekiti, which registered a single-digit infection. The data also includes a backlog of confirmed cases and discharged patients from Kano and the FCT, and 6 deaths from the FCT. No cases were reported from Abia, Bauchi, Ogun, and Sokoto states. Nigeria now has a total of 206,920 confirmed cases of COVID-19. In the current report, 176 patients have been discharged, increasing the total number of recoveries to 194,651. 9 deaths from COVID-19 complications have been reported in the last 24 hours, raising the fatality toll to 2,740. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. In Africa, there are more than 8.3 million confirmed cases and over 212,000 deaths have been recorded across countries on the continent. Globally, there are more than 236 million confirmed cases of COVID-19, while deaths are over 4.8 million.
The medical director of the specialist hospital in Yola, the Adamawa State capital, has described the establishment of a molecular laboratory by the Northeast Development Commission, NEDC, as a milestone in the fight against the COVID-19 pandemic. According to him, the state had gone through several challenges in the past to access tests from samples collected from patients, resulting in unnecessary delays. But with this laboratory in place, there will be improvement in testing and treatment of patients.
Adamawa State is getting a new molecular lab at the instance of the Northeast Development Commission, NEDC. It's been built and equipped at the specialist hospital in Yola, the state capital.
Equipped by Northeast Development Commission.
The managing director of NEDC formally hands the facility over to the state and in the care of the hospital's medical director.
To God be the glory.
We promise donating to the state a fully equipped infectious disease lab for the testing of COVID and other diseases. It gives me great pleasure to announce that Your Excellency will formally commission the laboratory at the Special Hospital Yola today for the benefit of mankind.
Guests and some members of staff take a tour of the facility to see the equipment and infrastructure available.
Have to work under some optimal temperature. Once the temperature is not maintained, the machines will not work.
For the medical director, it's a gift that will be appreciated beyond the borders of the state.
This asset is very, very important to the entire Adamawa state, and not just Adamawa state, but also other parts of northeastern Nigeria and neighboring countries like Cameroon. This is because a huge number of our patients also come from our neighboring country, Cameroon, Taraba State, Borno State, Gombe, and so on.
It will also make the fight against COVID-19 much easier.
During the peak of the epidemic, COVID epidemic, we had a lot of challenges with COVID tests. And at a time, we were flying specimen to Abuja, Jos, and the rest. And we had a lot of challenges because the FMC Yola was overloaded with specimen and we couldn't do a lot.
It will also cost less to process samples of not just COVID-19, but Lassa fever and other infectious diseases. The Northeast Development Commission has replicated this gesture in Borno, Bauchi, Taraba and Yobe states and is set to open another lab in Gombe State.
And for more on the national and sub-national response of COVID-19 in the country, joining us is the Cross River Commissioner for Health, Dr. Betta Edu. She's also national chairman of the Health Commissioners Forum. She joins us virtually. Thank you for joining us on the program.
Thank you for having me.
In Cross River State, like with a few other states, we're seeing parents, caregivers vaccinated against COVID-19 while the polio immunization is also ongoing for their children. Is this a sort of national policy?
So it's not a national policy. For us in Cross River State, we are having an integrated state policy on vaccination. So we want to be able to use the same health workers that are going out in teams to the field to get children vaccinated against polio, to do the same to their caregivers, vaccinating them against COVID. Really, we are looking at that integrated model because we want to be able to handle other diseases, not just COVID. We want to be able to deal with COVID, provide the vaccines for COVID. We want to be able to provide vaccines for polio, for other hepatitis and the rest of them. Most important is the fact that we have limited manpower, not just in Cross River State, but all across the nation. And we continue to stretch the same health workers to do the same thing at different times. So what we simply did was to come up with a strategy where we increased the number of team members, and then we assigned them, some to COVID, some to polio vaccination, some to other vaccinations. And so once you go into a community, into a household, you vaccinate the child against polio, and then you vaccinate the caregiver, the father, the mother, or any adult above 18 against COVID. And then, of course, in the same vein, we try to do screening for malnutrition when we find children who are malnourished, severely malnourished, and then, of course, other interventions which they go out with as a team.
So you and I both know how some people are still skeptical about taking the COVID-19 vaccines. Should the caregiver or parents hesitate to take the vaccine while on this polio drive, what happens then?
Okay, so it's not compulsory. However, the health workers have been taught on best of ways to advocate and engage with caregivers at the community level. At this point, we have over 500 million persons worldwide who have taken the COVID-19 vaccines already. So there's really nothing to be afraid of. It's just like any other vaccine that have been brought to the community. It's safe and it's free. And so you have nothing to worry about. We've given over 100,000 persons in Cross River State, different types of COVID vaccines, and we've not had one severe adverse effect following that vaccination. So there's no need at all to be worried about the COVID vaccine. And we're happy that caregivers are responding positively and they are taking the vaccine. And this is helping us, really, it's helping us to gain grounds, because stretching the same health worker to go to this house today to give polio and then go back tomorrow to give COVID and then go back next tomorrow to carry out screening for malnutrition, it's really what you don't want to do. And at this point, the integration method of vaccination as well as other health services is really proving to be very, very effective.
Quite a lot of work for the health workers, but as Health Commissioner, Chairman of the Health Commissioners Forum, for the next batch of vaccines, what more are you learning as to when they'll arrive? Also, we haven't heard much about the Johnson & Johnson vaccines being distributed to states. What can you tell us about that?
Okay, so a lot of lessons have been learned. In the first vaccination rollout for COVID-19, we didn't carry out the integrated method, and we had a lot of issues around logistics, funding it from the national, and several other concerns that came up with it. For this second phase, we had to come up with the integrated method just to cover more grounds, reach more persons, and have also really eliminate the issue of missed opportunity. For the next phase, we believe that lessons that we've learned from this, with, of course, the ability to manage logistics and the cold chain system better, even with the introduction of the ultra cold and chain system across the state, we will do lots better with other vaccines. For the Johnson & Johnson, we're still waiting for them to be distributed to states. I don't think it's done with the pharmacovigilance at the NAFDAC level. We have not received them in states yet. But like they said, it's not just for anybody or everybody. This will be used in places that are actually very hard to reach. It will equally be used in places that have security challenges, so that once the health workers go in once, they can just give one shot and they leave. And of course, some special group, like maybe the military and the rest of them that are out there in the field, that would be requiring the Johnson & Johnson. For the rest of us, I think we would be good taking the AstraZeneca vaccine and of course the Moderna, which is everywhere. For me, I took the AstraZeneca and I'm doing just fine. I didn't have any form of adverse effect following vaccination.
All right, we appreciate your time always on the program. Cross River Commissioner for Health, Dr. Betta Edu, also National Chairman of the Health Commissioners Forum. Many thanks for joining us on the program.
You're welcome.
And today is International Decent Workers Day, but some South African workers' unions are up in arms, demanding a string of things, including a promised 8% wage increase. Leading a stay-at-home protest today, umbrella labour body, the Congress of South Africa Trade Unions, converged on the Mary Fitzgerald Square in Johannesburg, from where they marched to the Gauteng Premier's office to deliver a memorandum of demands, some of which include issues relating to unemployment, workers' health, safety, corruption, wage cuts, collective bargaining, that it be properly addressed. The unions pledged to continue their protest if nothing is done to their demands. We asked them if it would be out of place to be patient with government as it is struggling with the COVID-19 pandemic.
We can't say because it's COVID-19, give government space for government to address COVID-19 issues. That's not how you address issues. You address issues because COVID-19 is a health issue and it has affected the economy. So therefore the state must be able to invest more into the economy so that the economy can breed jobs, so that the economy can make sure that the social ills in our society goes away. So we can't use COVID today. When before COVID-19, unemployment in our country was 29%. Now it's 44%. What happened before COVID-19? So corruption has eaten, SOEs has been mismanaged. So therefore, we cannot wait and say, our people, the working class, must continue to be poor, must continue to be hungry because we are addressing COVID-19 issues.
We have been very patient as workers. We have been very patient as workers with our government. So when workers want a proper accountability from our government and a proper incentive through paying what is due to workers. Our government does not want to do that. In fact, what our government has done is to attack the right of workers to collectively bargain. That is the issue.
Still ahead on the program, we find out how Poland is averting a fourth coronavirus wave. Please stay with us. Welcome back. The biotechnology company Moderna says it will build a factory in Africa to produce mRNA vaccines, including its COVID-19 jabs. Moderna said its goal was to produce up to 500 million doses annually in the new facility that could also include bottling and packaging capabilities. The company said it plans to invest about $500 million in the new factory. It also said it would soon start looking for a country in which the plant would be built. And Poland's daily COVID-19 cases have risen by around 70% in the past week to over 2,000, according to a government official on Wednesday, warning the country that a fourth wave of the outbreak is gathering pace. Poland's health service was stretched to its limits in the spring by a third wave of pandemic that saw daily cases exceed 35,000. But authorities believe vaccinations will help control the number of infections this autumn. Dr. John Tinashe is a member of the steering committee, the World Medical Association, and he joins us from Poland on the program virtually. Thanks for joining us.
Thank you. Thank you for having me.
All right. The latest data on COVID-19 cases in Poland has been referred to as a very fast flashing red lights by a deputy health minister. Is a fourth wave truly imminent, and what's the cause?
Well, to come up with such a conclusion, there are a lot of factors we have to consider. Right now in Poland, we have a situation with doctors as they are on what is known as a silent strike. Doctors are now less reluctant to go to work because during the COVID time, when COVID had first, started, the whole pandemic, a lot of doctors were taking extra hours and working and getting tired, overworking themselves, and they asked the government to increase their pay, which the government did not. As such, less and less doctors are now keen on working. And you find that there's more and more patients in need of medical services, and they cannot get them because of this. And also, another factor would be that most people in Poland are just not really interested in taking the vaccine. Some of it can be attributed to personal beliefs. Some of it can be the fact that unlike in the African hemisphere, the Western hemisphere, the people here, they tend to want their legal rights respected, their civil rights. And if the government tries to infringe on their rights in any way, they rebel.
It appears that, those you've talked about who are perhaps hesitant to the vaccines are centered in the southern and eastern regions of Poland. We understand that people there, many of them, decided not to get vaccinated.
Yes, as I said before, it's mainly due to personal beliefs. And also, I'm pretty sure you've noticed how this whole vaccine thing, how fast it was. That as soon as coronavirus hit the globe, companies like Pfizer, Moderna started producing vaccines, and people were very skeptic. And not a lot of people would follow healthcare professionals' advice because, even the healthcare professionals cannot give a straightforward answer as to how safe it is, because as we have seen in the past few months, that a lot of some people have had adverse reactions to these vaccines that have been produced.
And indeed, the healthcare workers would have to be convinced first before they can share that knowledge. But would you also say, what's your overall assessment of the pace of the country's vaccination program?
Well, generally, the Polish government has tried to introduce several incentives to try and persuade people to get vaccinated, some of them being monetary, where the Polish government has decided to open 1 million zloty, which is around 225,000 pounds lottery, to try and persuade a lot of people to get vaccinated. That way, they stand a chance to win this large sum of money. And they've also tried to incentivize small towns and small cities to get their people vaccinated, their local governments to get their people vaccinated, in order for these governments to get some funding from the central Polish government. So generally, everyone is just trying to get people vaccinated without infringing on their rights, and by trying to persuade them with things that they love, such as money.
Amongst other things, I'm sure. But then, Dr. Tanashi, with what restrictions currently exist in Poland at the moment, and do you think with this progression to fourth wave, could there be further restrictions on the economy?
I'll say right now, with regards to the economy, you can see that like every country suffered drastically because of the pandemic, and every country is now trying to find a way to try and pick themselves up in order to get back to that economic position they once held. To say that this the fourth wave coming would affect the economy would be a bit, I would say it would be a bit short-sighted, because as I've stated, the government has tried to introduce several incentives to try and get people vaccinated. Right now, they are now trying to have anyone above the age of 50 to get a third shot, or these booster shots, to try and increase the person's immunity to the COVID virus. And they've also set up a hotline on their government website, as well as several other rules that people need to follow, like the 1.5 meter distance from a person if you're standing in a line, wearing masks in places where they're heavily populated, or public transport, as well as for those coming into and out of Poland, you need to have a document that states that you have been vaccinated. And you also need to take a COVID test to see if you are not infected within the next 48 hours of your arrival into the country.
All right.
So there are several measures that the Polish government has taken in order to protect its citizens.
We appreciate your time. Dr. John Tanashi is a member of the Steering Committee, World Medical Association, joining us from Łódź in Poland. Thanks for joining us.
Thank you for having me. Have a good day.
You as well. Meanwhile, Finnish health authorities said Thursday that they would stop giving Moderna's COVID-19 jab to young men, following the example of Nordic neighbors over fears of heart inflammation side effects. The announcement came after neighboring Sweden, Norway and Denmark announced similar adjustments to vaccine policies. Here's more on the global update.
Finland has paused the use of Moderna's COVID-19 vaccine for younger males due to reports of a rare cardiovascular side effect, joining Sweden and Denmark in limiting its use. Officials say the country would instead give Pfizer's vaccine to men born in 1991 and later. Finland currently offers shots to people aged 12 and over. The UN Secretary-General has appealed for $8 billion to equitably vaccinate 40% of people in all countries by the end of the year, as the World Health Organization launches a plan aiming to inoculate 70% of the world by mid-2022.
Vaccine inequality is the best ally of the COVID-19 pandemic. It's allowing variants to develop and run wild, condemning the world to millions more deaths and prolonging an economic slowdown that could cost trillions of dollars.
And finally, Russia has reported 27,550 new COVID-19 cases, the biggest one-day tally it has recorded this year, amid a wave of infections that has pushed officials to urge people to get vaccinated. The government coronavirus task force also says that 924 people had died of coronavirus-linked causes in the last 24 hours, close to a record one-day toll.
The face mask helps to prevent the spread of COVID-19, protect those around you, and don't forget to wear one when in crowded places. You can take a look at our website. It has a better understanding of the pandemic. You can find several breaking news as well. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.